Hi, Land O'Lakes. It's Rochelle, your Land O'Lakes physical therapist. I haven't seen many of you in a while, but I'm here today to talk to you about it's time to breathe, respiratory health. So for the month of August, we want to focus on breathing and our respiratory health. So in physical therapy, we want you to be exercising your lung tissue. It's very important to exercise your lung tissue. It's also really important to breathe. Breathing, is it really necessary? Well, yes, it is. And I often get the question, Rochelle, how should I breathe? Don't we just breathe automatically? Well, we do, but what we should try to learn how to do is to breathe like a baby. So if you've ever seen a baby breathe, their little bellies just go up and down, up and down, up and down, up and down, because they don't have any abdominals. And so that's how they exercise their abdominals and gain abdominals. So when I say breathe like a baby, you should think of drawing your air in on an inhale and your belly expands, and you should breathe in your nose, sending air up to the chest, and then long exhale, twice as long as your inhale. Why, you ask? Well, when we inhale and exhale, the blood supply that runs underneath the lung tissue is full of oxygenation. And so we want to make sure that we are getting as much oxygen out of that blood to fuel our lungs for air and for respiration. It's also important to take a nice deep breath in and a long exhale because we want to keep the diaphragm, which is our respiratory muscle, from getting tight. And so we want to be able to make sure that we are taking a nice long deep breath and expanding and then exhaling and getting all of that air out. So something I like to teach people is just sitting perched on the edge of your chair. You want to be able to put a hand on your belly and a hand on your chest. And what you want to watch for is just monitoring how you're breathing. Don't try to alter your breathing. Just pay attention to how you're breathing. Are you breathing starting down here at your belly, or are you breathing up here starting with your chest? So a lot of times what we'll see is people that are doing this, and they don't know they're doing that. You're maybe in a meeting, you're on a call, you're in some sort of stressful situation, and pretty soon you notice your heart rate's elevating, your respirations are maybe going up, and all of a sudden your shoulders are up here by your ears, and all of a sudden your neck is kind of hurting, your shoulders kind of hurting, your back is hurting. And so what we call those people are neck breathers, or they're accessory breathing. So they're using all of these muscles up here to essentially breathe. Short little breaths. And think about it, when you're in a stressful situation, we don't really stop to breathe. It's an automatic function. So when we're breathing like that, taking these short little breaths, we need to pause and just take the time to just do some longer breaths with a nice inhale, about 3 seconds, 4 seconds, and a long exhale, about 4 to 6 seconds, because we want to be able to get all of the air out so we can get all of the air, good air in, okay? So if you perch on the end of your seat and you sit up nice and tall again, you're going to breathe in your nose. You're going to exhale. Did you hear that ah sound? So you want to make that ah sound. It just helps you to recruit those abdominal muscles to help get all the air out. And then you're going to repeat that. So it looks like this. Inhale and exhale. And you're just being mindful that every time you inhale, your shoulders aren't coming up, your neck isn't tightening up, and everything, all the work is coming from that belly, and you're sending air from that belly up to your chest, lifting your chest bone and expanding your lungs, and even pausing and holding the air in those lungs and just breathing in and out. So whether it's 5 minutes of breathing or 5 breaths, learning how to do proper diaphragmatic breathing and taking the time to do it can greatly reduce the amount of stress and tension that you're holding in your neck, shoulders, and back. If you have any questions about this or you need a physical therapy appointment, please feel free to give us a call at the clinic. Thank you.